Hey everybody, it's Tina here today to talk about low supply or perceived low milk supply. Um, I know as a breastfeeding mom, almost every breastfeeding mom that I talk with, and I also worried at some point during my breastfeeding experience that whether or not I was making enough milk, is baby getting enough milk? You hear almost every mom worries about it at one time or another. So we're going to address that a little bit today. Um, in the beginning, when you first started breastfeeding, the first few days, your body produces colostrum, which is extremely important. It helps baby with that first bowel movement. It has lots of really important things that baby needs just during those first few days. So I remember visiting a relative in the hospital one time, and the baby had been born just that day, and she was concerned because she didn't think she had any milk. So don't assume that you're going to have this big milk supply during the first few days. Baby, nature knows exactly what to do, and baby just needs colostrum during that time. So, uh, so usually milk will come in 3 to 5 days after you give birth. And when I say come in, meaning mature milk, you'll see the the watery looking, it almost looks like watery cow's milk as opposed to the colostrum. Um, Sometimes it does take a little bit longer than those 3 to 5 days. I know for me personally, with my first baby, it took, I think it was like 6 or 7 days, and I was really worried. And thankfully, I spoke with a very well informed doctor who told me to just keep doing what I was doing and not to worry. And sure enough, eventually my milk came in and we were off and running. But it did take a little bit longer with my first baby. With my subsequent pregnancies and when my babies came, it was much quicker. Some moms actually leak during pregnancy, which is a really good sign. But don't worry if you don't, because I never did and successfully breastfed 4 babies. So it's not an indication of whether you'll have a good milk supply or not. um, the best thing you can do once baby is here is to just breastfeed as often as possible. Watch for those hunger cues and don't watch the clock. If baby, it seems like baby just nursed and he or she wants to nurse again, that's great. Just let him because that's the best way to build your supply. And the reason I'm talking about this is because in order to not worry about low milk supply, you really want to get a good during the first couple of weeks. Don't worry about adding formula because that can really mess with your supply. As long as you are nursing on demand, and you're not going to overfeed a breastfed baby. So anytime baby squawks, best thing you can do is just put him to the breast, um, and that's going to help you build that good supply. Try to stay away from artificial nipples. Definitely no supplementing with anything. Just breast milk is all baby needs. So to build your supply, and you of course you want to be watching for bowel movements, for wet diapers, and for weight gain. Now every baby loses a lot, or I should say, every baby loses a little bit of weight at the beginning. Sometimes breastfed babies lose a little bit more. Sometimes it looks like certain babies lose a little bit more, and sometimes that can be from medication. They're actually losing water, especially with C sections. If you've had an IV, it looks like babies got a lot of liquid, a lot of buildup of medications and IV and that type of thing. And so it can look like baby lost more weight. Just kind of hang in there and keep breastfeeding as often as possible because one of the biggest mistakes that I see moms make is to top off baby with formula. So in other words, breastfeed and then add formula or what have you. And that really can mess with your milk supply. So just breastfeed as often as you can, um, and put baby to the breast every time she squawks or he squawks. There's really no need to pump. I mean, if you're engorged, and another thing, don't worry about if you don't feel like you're engorged that you're not making enough milk. That's not true either because I personally never got my breast felt a little bit fuller, but nothing like I anticipated. You hear these stories of how painful it is. I didn't deal with that with all 4 of my pregnancies. I didn't deal with that. So that's not an indication of milk supply. So I was going to say, no need to pump. If you do get engorged and you want just a little bit of relief, you can just take a little bit off the edge. Breastfeeding, like we've talked about before, is law of supply and demand. So the more you breastfeed, the more milk your body's going to make. Um, so obviously, you don't want to do a full pumping session if you're engorged because that'll just tell your body to continue to make more milk. But just to take the edge off, you can do that. So like I said, no artificial, no pacifiers, no artificial nipples, no formula, and just really get that milk supply off to a good start. There will come a time, and I can't really tell you a specific time. It's a little bit different for everyone, but I have moms call me and say, I think my milk supply is low because I don't feel engorged anymore. I don't feel as tingly when it's, when I feel like I should or what have you. But I can remember coming to a point where your body kind of adjusts. And so it gets a little more comfortable, maybe. And that's also not an indication of milk supply. And if you are pumping for whatever reason, don't look at how much you pumped and worry that baby's not getting enough because you've only pumped an ounce. Baby takes much more at the breast than a breast pump does. So that's also not an indication of supply. So even though it is possible for moms to have low milk supply, if you are strictly breastfeeding and not doing any of the things that we talked about, it is very, very rare for a mom to have low milk supply. If there's been a medical issue, a glandular issue, or medications maybe can cause low milk supply. So, or a change in milk supply. Lots of times, moms will start to call me after they've started certain birth control and not realize it, and that can cause their milk supply to drop. So it is possible, but usually it's because they've added formula. That's usually the reason. Very, very rare for a mom just to have low milk supply unless there's a determining factor that intervened or in getting breastfeeding off to a good start. So, like I said, in the beginning, colostrum, 3 to 5-ish days probably. The mature milk will come in, sometimes a little bit longer. Don't watch the clock. Put baby to the breast as often as you can. Lots of skin-to-skin contact. Watch for diapers. Keep your WIC appointments, your pediatrician appointments to make sure everything's looking good. And call me anytime. Call or text. You can private message me here on Facebook if you have any questions. But like I said, don't be surprised if you worry about that at some point. Almost every mom worries about that at some point, and it's very rare for that to be an issue. So that's all for today. If you have any questions, don't hesitate to contact me however you want, call, text, whatever. And I hope you're enjoying the last couple weeks of summer and looking forward to fall with the new schedules and everything in place. So I hope you all are well, and contact me anytime, and I'll talk to you soon. Thanks. Bye-bye.